Hello, Assalamualaikum, and thank you for attending this session. My name is Alia Kasina binti Khairul Anwar. I'm the moderator for today's session. Our topic is social anxiety and depression among the students of KPTM content during the pandemic. So, during the pandemic, students at KPTM content experienced social anxiety and depression. We all tend to jump to the worst case scenario in the absence of information. So we thought this session would help us all gain clarity on what is known versus what is speculation or even exaggeration. So we have 4 panels for today, which is Nur Aina Natasha binti Ahmad Nizam, one of the students at Captain Content, Aizat bin Zahardin, one of the students' parents, Nabila Azani bin Muhammad Zaid, Captain Quantum Counselor, and last one is Dr. Ahmad Farid bin Cik Zulkifli, a psychologist at KPJ Tanjung Lumpur. So let us begin with Aina Natasha. Hello Aina, how are you? You can also introduce yourself.
Hi, I'm good. Thank you for asking. My name is Noaina Natasha binti Ahmad Nizam. I'm from College Polytech Mara, Kuantan. I am 19 years old this year.
Okay, Aina. As a student, do you know anything about social anxiety or and depression? Or have you ever been in a similar situation?
Yes, I had an experience during the pandemic in which I discovered that I have social anxiety. I am unhappy about attending a university or have become very nervous around people such as friends and peers. And I am also concerned and sad about my low GPA. I'm usually prefer to be alone when I am experiencing stressful feelings. However, I am unaware that being alone with experiencing stressful feeling can lead to depression. When the government announced that we could finally have a face-to-face class, I had to study a new language, Japan. I was nervous at the time and could concentrate in class. I worried because if I don't pass, I'll be out of work. I may not be able to graduate from the university. Not only that, but financial anxiety is a problem that many students face when attending higher education institution. Because I am is responsible for paying for my study. This financial stress causes students to experience anxiety, which cause them to suffer psychologically distress that result in a lower grade point average GPA. Some students who face difficulties in understanding difficult subjects depends on costly private instructor. Students also need money for daily expense, such as food and transport. When students feel they do not have enough money, they may be anxious and ask friends for money, which negatively affects students' feelings, leading to stress and anxiety.
That must be tough for you. So how are you feeling?
I'm doing well right now because I'm dealing with social anxiety and depression with to have with the help of a counselor.
That's good for you. Now we move on to Aizat bin Zaharuddin, one of the students' parents. How are you, Mr. Aizat?
Hi Alia Kasrina. I'm good. Thank you for asking.
Mr. Aizat, I have one question for you. What suggestion would have you helped as a anxiety?
In my opinion, the suggestion as parents in dealing with social anxiety is we must ensure that our children and teenagers do not spend too often and all day in the room. Also, not hang out with family members. However, we should prevent it by taking some time to communicate or spend time with children. That's all for my opinion.
Okay, Mr. Aizat, thank you for answering. The next panel is Miss Nabila bin, a counselor in KPM Kuantan. How are you, Miss?
For the last few days, I have got sore throat, but it's getting better. Thank you, Alia, for asking.
You're welcome. So I have one question for you. As a counselor, how do you know your students are having social anxiety and depression?
As a counselor, I already know many people who have suffered from this anxiety disorder. Most of them are students. Why do I say that many students suffer from this anxiety disorder? Because today, students are less social with people because that when the lecture giving assignment in the form of presentation, they cannot do perfectly because when waiting to start the presentation will come with a very fast heartbeat and trembling hand. What I know about this anxiety disorder is that most generation nowadays like hang out with people. They prefer to be alone in their room and play cell phone. They also talk less their parents. Their parents in high school and beyond. Students are typically more self-focused and may have harsh negative thoughts about themselves. They may be more likely to bumble or avoid eye contact. This the older students often struggle with academic as they are unable to participate fully in class or to engage in group and oral project.
Do you used to work with psychologists back then?
Yes, I used to work with psychotherapy. Suffer of social anxiety can learn about the trigger that lead to their difficult emotion and behavior. Cognitive behavior therapy can help you to learn how to start replacing those difficult emotion and behavior with more positive one.
Thank you, Ms. Nabila. In this session, we will learn about the symptom and definition of social anxiety and depression. Some people will look down judge those who are in this situation. The next panel is Dr. Chiang Farid. How are you, Doctor?
I'm good, Alia. Thank you for asking.
I have one question for you. What is definition social anxiety and
Social anxiety disorder is a common type of anxiety disorder. A person with social anxiety disorder feel symptoms of anxiety or fear in situations where they may be evaluated or judged by others. As example, people will be nervous if they speaking in public, meeting new people, or having to talk to a cashier in a store. For depression, in psychology, is a mood or emotional state that is marked by feeling of low self-worth or guilt and a reduced ability to enjoy life. A person who is depressed usually experiences several of the following symptoms, such as feeling of sadness, hopelessness, lower self-esteem, and heightened self-depreciation.
So doctor, how to treat social anxiety and depression?
In my point of view, our country has a lot of options to treat social anxiety. The first option is by using strategies such as mindfulness and goal setting to reduce our discomfort and anxiety. However, different therapies for different type of people, so it can be helpful to discuss what form of therapy may be right for you with a mental health professional. The second option is using CBT, a research support type of psychotherapy. It's commonly used to treat social anxiety disorder. CBT teaches us different way of thinking, behaving, and reacting to situations to help us also feel less anxious and fearful. It also can help us improve our social skill, which is important for us. CBT has been all well studied and is the gold standard for physiotherapy.
That's a lot of information. Thank you, doctor. Back to Miss Nabila. Do you have any tip for coping anxiety disorder?
Yes, I have, such as keep physically active, develop a routine so that you are physically active most days of the week. Exercise is a powerful stress reducer. It can improve your mood and help you stay healthy. Start out slowly and gradually increase the amount and intensity of your activities. Avoid alcohol and recreational drugs. These substances and can cause woods or worsen anxiety. If you can quit on your own, see your care provider or find a support group to help you. Make, make sleep a prior, priority. Priority. Do what you can to make sure you are getting enough to help feel rested. If you aren't sleeping well, talk with your care provider. Next, eating healthy food. A healthy diet can incorporate vegetable, fruit, whole grain, and fish may be linked to reduce anxiety. But more research is needed. Learn about your disorder. Talk to your health care provider to find out what might be causing your specific condition and what treatment might, might be best for you. Invoice, invoice family and friends and ask for their support. Stick to your treatment plan that might fit for you guys.
A little bit of tips from Miss Nabila. Let's move on to Mr. Isaac. As a parents, how can we educate to people out there about social anxiety disorder so they can help their kids to be diagnosed and treated?
As we as a parents, uh, would like to give a suggestion to parents or people out there in the future that to recognize the symptoms of social anxiety that often occur in the middle of the age of 13 years. In addition, it is better to prevent them from 3 to 4 years old. However, we must expose them to accustom them to socialize with with people. That's for my suggestion.
Thank you, Mr. Aizat. In this situation,
Welcome.
parents must also provide moral support to their children. Before we conclude this session, let us ask Aina Natasha, as a student, how she overcome anxiety and depression physically.
I suffer from anxiety, can manage my negative feelings through exercise like walking, swimming, and playing tennis. I join sport club, which result in an improvement in their positive and happiness. Taking part in physical activity can greatly reduce the negative psychological health impact on a student's body and mood, reduce mental difficulties, and improve their health well-being. I may prefer to reduce my anxiety by reading books about mental health and dealing with anxiety to be aware of how they can manage my symptoms.
Thank you, Aina. Now let's hear some advice from our panels. It begins with Dr. Farid.
Okay, so a tip for the student that have social anxiety is to practice breathing exercise. It is because breathing exercise is important for students to face fear head on, or there will be a strong risk of becoming adult with social anxiety. Simple breathing exercise will help students to stay calm and reduce the anxiety they are feeling at the moment. When stress creeps in, that's the moment to pause, breathe, and get centered. That's all from me.
Uh, Next, Miss Nabila.
We as a counselor should always care about students so that they do not feel that they are not valued and not cared for by the public. The role of the counselor is very important to reduce a person's suffering from depression and anxiety.
Okay, next, Miss Isaac.
Lastly, our advice for to teenagers or children out there, if they are having a problem of social anxiety, we should try to talk to people and deal with it calmly, because every problem must have a solution so as not to lead to worse. Alright, that's all from us.
Thank you,
Alright.
Isaac. Last one, Aina.
We must communicate with people around us and do not keep it alone because that will cause depression and anxiety disorder. That's all.
So that's all for this session. Thank you for all the panels who attended. We hope you guys can learn and take a lesson from this session. We wish you have a nice day. Stay safe and please take care of yourself. Thank you.
Thank you for having us today.
Alright, thank you all.
Thank you.